Okay. Welcome to our monthly Missouri Community Betterment Lunch and Learn. Thank you for joining us today. Um, we are so glad that you are a part of Community Betterment. Sorry, my screen is not cooperating with me. There we go. Okay. Thank you for joining us. We are glad that you could be here. Just to give you some familiarity with um, the folks that make up the MCB Board of Directors. Our president is Brett Dinkins from St. Louis, Missouri. Our vice president is John Robinson from Caledonia, Missouri. Our secretary is Jeff Corman from Jefferson City. Elaine Campbell is from Houston, Missouri, is one of our past presidents. Tanya Watson from Buffalo is our most recent past president. Jennifer Whitson's from Sealville, Missouri. Diana Hucksep is from Louisiana, Missouri. Paula McCrae is from Maysville. Emily Smith is also from Sealville. And I'm Elizabeth Anderson. And I work with a bunch of different counties in Missouri through MU Extension, and my original posting was in Lynn, Missouri. We also have Brenna Bontrager from Independence, and then we have 3 board assistants: Cece Spink, our executive assistant, Darla Hagee, for our event planner, and Vicki Jones, our development associate. Any of you who have hopped on the call, if you don't mind, you could come off chat and introduce yourself and tell us what community you're joining us from in Missouri, or you can drop that in the chat.
Hi, I'm Dana Hodges, and I'm with the City of La Plata, the La Plata Community Betterment.
Great. Thanks for coming, Dina.
I'm Elaine Campbell, and I'm from Houston, Missouri, Houston Community Betterment.
Charles, what about you?
Hello, I am Charles Thomas. I'm joining from Betterment.
All right, thank you. Today we're joined by Amy Bradshaw and Nicole Cooper. Amy works as the East and Southeast Maternal Child Health District Nurse Consultant with the Maternal Child Health Services Program from the Missouri Department of Health and Senior Services, and Nicole Cooper, who is a Public Health Program Supervisor from the Center for Local Public Health Services from the Missouri Department of Health and Senior Services. And they're going to talk to us about what kind of a resource our local public health entities can be for our communities and how we can partner with them. I don't know which one of you wants to speak first, but I'm going to turn off my slides to turn it over to you so that you can share anything that you would like to.
I can go first if that's okay.
Perfect.
Okay, great. As she mentioned, my name is Nicole Cooper. I'm a public health program supervisor with the Center for Local Public Health Services with Department of Health and Senior Services. Been here with the department for a couple of years, but have a very long background in state government going back to 2000. So I've got about 24 years in. But I've only been with DHSS for a couple of years, and it's been very, very interesting. I love the work that we do here. So we here at the center, we are the liaison for the 115 local public health agencies across the state. So we are kind of their point of contact for anything they need from us. They obviously work with several different departments within the Department of Health and Senior Services, just for example, or chronic disease, maternal health, environmental, and all those other bureaus. But when they don't know what they need or where they go, we are their all stop. This is where they come when they're looking for assistance and they're not quite sure who they need to turn to for it. We partner with them also through the center here with different types of funding streams given to the local public health departments to try to help them just in their day-to-day activities and run their programs. We offer technical assistance and just try to keep up a good communication outlet to them so that they can stay appraised of what's going on in Missouri. Our LPHAs, they're very diverse. If there's the notorious saying, if you've seen one, you've only seen one, because each one is different. Each one runs the health department a little bit differently. We have very small health departments to 3 to 4 employees, and then you range up in your urban areas to 100 plus employees with these health departments, and they're all governed a little different. Some are under commission, some are board governed. So they are autonomous. We just assist where we can with funding and technical assistance for them. The one thing I did want to kind of share, let me share my screen here. Okay, can everybody see? Should be a wheel in front of you. Can you see that? Okay.
Yeah.
So this is kind of what our LPHAs work on and work towards. This is based off the 10 essential public health services that the state has been previously recognized. This was made by a grassroots organization, healthiermo.org. You can see the web address on the wheel there. But this is really what we're working towards. If you look in the middle of the circle, those are our core public health foundational services. That's what each LPHA should be able to do at their LPHA. They should be able to touch all of these initial services. Now, with that being said, our LPHAs are their funds, the funding that streams for our LPHAs or that supports our LPHAs is a little different. There are LPHAs that do not have what we call a mill tax, which means they receive no funds from their community or their county. The only funds that keeps them going are funds through DHSS and federal funds, which means they don't have any support. So at the beginning of their budget period, they're literally at a zero because they're not getting any tax revenue in to help support them. So they all work on pretty tight budgets, I would say, most of the time, trying to provide these programs that they're doing for the communities. Now, the middle of the wheel is kind of giving you the foundational public health services that each LPHA should be trying to do. And then if you move to the outside of the wheel, you're going to see, I think there's 7 capacity type blocks, and those will help you monitor the capacity you have to deliver that public health service. So for instance, maternal, child, and family health, if you flip it and you match it to assessment and surveillance, that's a capacity that they need to do within that program in order to see if they're actually giving that service to the best of its ability to the community. So actually with Department of Health and Senior Services, they're actually, through the help with our public health infrastructure grant, assessing the health departments as we speak to try to find out what kind of services and capacity of services we have right now and what we need to have in order to fully be able to meet all of these capacities and do all of those capacities for each one of these services, and where that gap is. How much more funding? What do we need? How much more FTE do we need and funding for a health department to meet all 6 of those services and all of those capacity gaps? And then obviously you see the small circles of health equity, social determinants, local responsiveness, which that is just mixed into all of your services. Each service that's provided should be looking at the health equity of the service and the social determinants of the service. So that's kind of a brief explanation of our LPHAs and everything we do with them and what they're trying to do and how they're trying to help their communities. Like I said, each one of them runs different programs. If you've seen one, you've seen one. You could go to one, like here at Cole County, I know they do the milk bank for mothers who are needing donor milk for assistance. And, some counties don't provide that service. It just really depends on the capacity they have at their health department and the different services they can provide. And I'm happy to take any questions if anybody has anything. Okay. You're on mute, Elizabeth. Oh, there you go.
Okay, sorry. I was going to say, does anybody have any questions? If you don't feel like coming off mute, you can also always drop them in the chat and I can keep an eye on that as well.
Okay, well, as always, you can always, reach out to your local health departments and try to partner with them in different communities to provide these services and help them, with anything that can be done. Thank you.
Thank you so much, Nicole.
Okay, so I'm next. So let me see if I can share my screen. I see. Oh, we have to stop sharing. Oh, wait. Yes, I will stop sharing others and we're going to go with screen one, share. Okay. All right. So I am Amy Bradshaw with the Missouri Department of Health and Senior Services, the Maternal Child Health Program. And today, hold on just a minute. I gotta move these bars around all over the place. Okay. And so do you just see like one big screen? Because it's different because I have multiple screens. Okay. So I have been with I'm with the Maternal Child Health Program. I've been with the state for 22 years, with the Maternal Child Health Program for, 22 and a half years, I guess, for 22 and a half years of that. I did special healthcare needs for a couple of years when I started. And so I do cover the East Southeast District, as it was stated earlier, and work directly with local public health agencies. And so today I'm just going to talk a little bit about the Maternal Child Health Program and how local public health agencies work with others in their community, too, and basically what the program is, but and how they can work with, like, for example, schools is the main focus that we're going to do. All right. So this is just, we're going to be talking about the local public health in Missouri, Maternal Child Health Program, powers of partnerships and partnering and sharing. Okay, so local public health agencies are located throughout Missouri, and they work, to improve the health of thousands of Missourians, as we heard earlier. They can address a wide range, and it kind of showed you on the wheel. And then, of course, as Nicole said, they're all very, very different. But this just kind of highlights a little bit of the history of local public health agencies. Most of the local health agencies, they were formed under Chapter 205, which was Revised Statutes of Missouri, which allowed counties to enact a property tax. That was talking about the meal tax, but of course, not all of them have that. Each of these public health agencies, they have elected board of trustees, and they set policies for the agencies. other local public health agencies, they might be governed by like local elected bodies such as county commissions and city and county councils. And in my position, I know that that's very different and a little bit harder sometimes for me to get used to. I used to only cover the very rural counties, and then as we reorged, and then I got some of the bigger counties. When you do talk about St. Louis City, St. Louis County, St. Charles, it's a little bit different. So as it was stated earlier, Missouri does have 111 local public health agencies that operate independently of each other. And of course, the funding for many of the contracts, it comes from like the city Center for Disease Control and Prevention and other federal agencies, and then state general revenues and other sources. Let's see, local public health agencies, they work with numerous partners, as I said earlier, and that's going to be private health care professionals, health advocacy organizations, and this is all to improve the health of Missourians. And of course, one of them is us, the MCH services contract, and they have deliverables in selecting a priority issue, that they develop a contract work plan. All right. So this is just looking at revenue sources for the local public health agencies, being taxes, grants, contracts, fees, and donations, state funds through contractual arrangements, and then federal funds, which are directed, like the maternal child health, it's directed through the Department of Health and Senior Services. So Missouri receives funding from the MCH Bureau of the U.S. Health Resources and Services Administration, which is called HRSA, for improving the health of women, particularly mothers and children. And this funding is known as what we call the Title V Maternal Child Health, or MCH, block grant. So that's the federal dollars that come down to Missouri, and it provides funding for the state. And then, of course, that funding is within, kind of divvied out to different programs. And then for our program, it then goes down to the local level. Let's see, hold on, did that slide over? Oh, sorry. Now, so the Missouri Department of Health, under the Division of Community and Public Health, it's responsible for administering this MCH block grant for the state of Missouri. And so the Title V block grant plays a key role in like the provisions for maternal and child health services in Missouri. The funds are from grants, are distributed among a number of programs, like I said. And so like Missouri has Missouri wrote a plan and to work on certain things within the state, and it's like over a 5-year period. So there's a statewide needs assessment that's conducted, and they identify those priority health issues that they want to work on. And through our program, then what we do is look at what Missouri has chose to work on, and then we kind of pass that down to the local level, and they evaluate their county to determine which one of those indicators that they're going to work on. And so the national priority areas in which Missouri chose to work on for the 5-year period that's currently in place, that goes through federal fiscal year 26, is to improve preconception, prenatal, and postpartum health care services for women of childbearing age, promote safe sleep practices among newborns to reduce sleep-related infant deaths, reduce intentional and unintentional injuries among children and adolescents, reduce obesity among children and adolescents, ensure coordinated, comprehensive, and ongoing healthcare services for children with and without special healthcare needs. Then we have state priorities. So those were the national priorities. We have state priorities that we were able to choose, and Missouri chose 3, which were enhance access to oral health services for children, to promote protective factors for youth and families to prevent and reduce youth suicide and self-harm, and then also to address the social determinants of health inequities through training in health literacy, which is like a cross-cutting. And then the overarching principles is also to assure access to care, including adequate insurance coverage for the MCH population, and to promote partnerships with individuals, families, and family-led organizations to ensure that families engage in decision making, program planning, service delivery, and quality improvement activities. So the MCH services program, it is 100% federally funded through the Title V block grant. And any of the local public health agencies in Missouri are eligible to participate. If they so choose it, and the ones that don't, it just has to do with the capacity to actually do it. So the services contract, it refers to as the contract work plan. So that's what they develop within their county. So the purpose of the MCH services contract is basically to support, the LPHAs, they support a leadership role within their community for a community-based system. So it's a systems change that we want to see. And so our contract is actually based on what we call the spectrum of prevention. So there's 6 levels of that spectrum where we have, they work at an individual level, the community level, they work with providers, community partners, they try to do organizational changes, and then also at the at policy legislative level. So they have 6 different outcomes that they have to work on. So this is our team, the MCH team. So you'll see me there as the East Southeast District Nurse. Sarah Gorman, she is the MCH Program Manager. We have Lindsay Cobb, who's in the Southwest District. Macy Shin is in the West Central, and Sarah Thompson's in the Northern District. And so here is a map, and the colors will show. So I'm over here, the pink to the east, southeast, and then you can see how it's all divvied out. That's our map. So this slide, this just kind of breaks it up to show you how many counties are working on those different areas that that I mentioned that Missouri works on. So we have 20 that are working to improve preconception, prenatal, and postpartum healthcare. 23 that have selected obesity among children to reduce obesity. 23 working on reducing intentional and unintentional injuries. 32 to promote protective factors for youth and families. And just to point out too that a piece of that is to reduce suicides. Also, so 7 have selected promoting safe sleep, 7 on enhancing oral health care, 1 working on the, ensuring coordinated, comprehensive, and ongoing health care, and 1 selected to address the social determinants of health and inequities. Okay, so this is just talking about the power of partnership. That's kind of what I'm going to talk about now, and how through the MCH contract, the LPHAs have partnered with local schools, and they can do more than schools, but this is just an example. A lot work with daycares and different community organizations. But so, for example, we have Stone County Health Department and Galena R2 school districts have partnered together. And as you can see, this is just some information. Whoop, my whole thing fell. I was trying to move that around. The Stone County, located in Southwest Missouri, Table Rock. And you guys do not want that up there. I don't know why it keeps going. So Table Rock Lake is the largest employer is Silver Dollar City, and this just shows you square miles land. All right. And then we have the Galena School District. It's located in Stone County. There's 500 students that attends the school. More than 60% of the students qualify for the free and reduced lunch, and there's 4-day school weeks due to staffing shortages. So with the maternal child health services priority health issue, after looking at their data for Stone County, they looked at their data and to determine what they wanted to work on, and the health priorities were considered strategic issues, fundamental policy changes, and critical health challenges. But they kind of looked at their main being mental health and wellness, which would be suicide. So this just kind of looks at the achievements that they worked with their school. So in 2022, they worked with the school counselor to provide the suicide prevention trainings to 7th through 12th graders. 2023, they also did the suicide prevention, and it's kind of like they build on, each year adding more. They worked to develop policies that students' name badges have that the 988 message, which is related to suicide prevention. And they also hosted an all-student assembly at the high school, which was called The Dangers of Today's Marijuana. So to replicate, this presentation is also used just to help get an idea of how you might partner. Of course, you want to get to know your LPHAs and reach out with any questions and invite them to participate, not only in school-based events, but if you have other events, maybe you're just doing like a community wellness, event. Always reach out to your local public health agencies because they have a lot of things that they could offer. Also here on Shelby County Health Department, they working with North Shelby and South Shelby schools. This is just telling you a little bit about where Shelby County is located, population of 6,103, county seat Shelbyville. And then they have 2 school districts, north and south. One school district has 298 students, the other 706, and they're pre-K through 12th grade in their districts. With their maternal child health contract, they are working to reduce obesity among children and adolescents because, childhood obesity is, is an epidemic. Over the past 3 decades. The rates have tripled. So that's what they're working with them. So this is just kind of showing. So from 2021 till the present, they've increased the number of youth engaged in daily physical activity, created a countywide youth cross-country team. So they didn't have a cross-country team, so they developed one with 30 to 38 youth runners each season, which led to middle schools developing their cross-country team. They increased in 2023, increased access to healthy food options in the schools, incorporated healthy food choices into sports concession menus, increased knowledge related to physical activity and nutrition education, and they increase in community partners working together. So that's a big thing with our work, the work plans is, getting that whole community involved. It's a systems change. That way, it's not just one person doing all the work. We're all working together. And that kind of concludes, and that was just some examples. I mean, every county, I meant to point out when, let me go back here to the map real quick. I wanted to point out something to you. If I can find it again. I meant to point out that which you could take a look at which counties a little bit closer are. Well, if I can get to it, my gracious. Oh, there it is. Okay. So if you see on this map, you see the grayed out ones. There's only 3. So those are the ones that do not have the maternal child health contract right now. So everyone else does. So that just kind of gives you an idea, depending on what county that you're in. So,
I have a question.
sure.
This is Elaine Campbell, and I'm from Texas County. And with the slides that you prepared for Stone County and Shelby County,
Uh-huh.
are there some slides like that somewhere for Texas County, or is that just what you just used to? Or is there a place that we could go and I could see what Texas County has?
Okay, so this was actually we had presented this initially at the school health coordinated school health conference, just to kind of show an idea of how the schools could partner with their local public health agencies. So we're just sharing that one here. But I mean, you can definitely get in contact with us. And I mean, I would have known back in the day because Texas County used to be mine, but it's not my county right now.
Okay.
So, but yeah, you can feel free to reach out, and we can share information about what they're working on. Because right off the top of my head, I don't know.
Yes, I understand.
Just because it's not my county, and anymore, I have 28 counties now, so it's hard to remember, to be real honest with you.
No, I
Yeah.
wasn't thinking you
Yeah.
would just know off the top of your head.
And so
I just thought maybe
what-
you might have a website or something that I could go and just put select Texas County and it would tell me these things.
You know what? So, I mean, the maternal child health program does have a website, but I don't know if we have all of the individual information. Let me, so what is your email address?
I'll put it in the chat.
Okay. All right. And I can send you something about what Texas County is working on.
Oh, that'd be good. I worked with Texas County when we were doing healthy schools, healthy communities, but it's been like about 5 or 6 years ago. And so I just like the way you had it laid out for the last 4 years about what they were working on. And I just hadn't seen that. So thank you.
You're welcome. Here, I can stop sharing maybe. Oh, there we go.
All right. Does anybody else have any other questions for Amy or Nicole?
I'm glad that they have this going on all over our state, and every county has got goals every year, and then looking at them, and then especially working with the schools and all ages. So this was very informative, and I thank them for coming and sharing with us.
All right. Well, thank you, Amy and Nicole, so much for joining with us today. This will be posted on our Missouri Community Betterment YouTube, just like any of our other Missouri Community Betterment resources. And I hope that it will be helpful to folks, and they'll be really thinking about how they can engage with their local public health agencies. Let me skip through my next couple slides. If anybody wants to stay in touch with Missouri Community Betterment, you can go to our website, mocommunitybetterment.com. There's a contact us button that will send an email straight to us. Then that phone number listed, and then you can find us on YouTube, Facebook, and Twitter. And then we always like to give a shout out to our MCB Better Together Fund. It helps us to continue to offer sustainable programming like our annual conference and these lunch and learns and a variety of other goals that we have coming up for future years. If anyone's interested in that, this QR code is where you can get some more information. And thank you all so much for joining us today. And I hope you have a great rest of your week.
Thank you. Bye.